So, good morning, my dear friends. Today we'll discuss about the cardiac tamponade. So, whenever you're dealing with cardiac tamponade, please remember you should look for three important things. First thing is backstrad. The patient will be having in emergency hypotension, or if the patient had raised JVP with prominent X descent, muffled heart sounds. So you should look what is the backstrad, muffled heart sounds, and the patient will be having a prominent X descent with JVP raised, and the patient will be having hypotension, and they'll be having characteristic pulse which is called as pulsus paradoxicus. So please remember, anytime you look for the pulsus paradoxicus, please remember to look for cardiac tamponade. Okay, all the best for your competitive exams. Remember, cardiac tamponade is very important. In cardiac tamponade, what will happen? There will be increase in the pericardial pressure. So whenever pericardial pressure is raised, so whenever intrapericardial pressure is raised, there occurs the equalization of diastolic pressure. So equalization of diastolic pressure and increase intrapericardial pressure will decrease the LV fill-in time. So patient will be having decreased stroke volume. So patient will be going for hypotension. So cardiac tamponade, please remember, muffled heart sound, raised JVP, hypotension, and the patient will be having the characteristic pulsus paradoxicus. Okay, and there are conditions where cardiac tamponade with absent pulsus paradoxicus can occur. That is, if the patient is associated with AST, or when ejection fraction is very low, or if the patient is having LVH, or when it is associated with uremic. The immediate treatment in case of cardiac tamponade is pericardiocentesis. And when patient is having recurrent pericardial effusion, we should use bleomycin, or we can use a shunt pericardiotomy, creating a shunt. Okay, this is the thing you should remember regarding the cardiac tamponade. Okay, all the best.